hopefully keeping those at greatest risk of complications from COVID-19 out of hospital. Alberta, the latest province, rolling out a new drug Tuesday.
But let me stress that Sotrovimab is not a replacement for COVID-19 vaccines.
It's not a pill you can pop, but rather a drug given by IV. So Alberta Health Services will be sending EMS teams to the homes of those recently diagnosed with COVID-19 to give the Health Canada approved treatment.
Who are age 65 and older, are positive for COVID-19, unvaccinated, and who wish to have this treatment offered.
For people at high risk of progression to hospitalization or death, we can use this drug to reduce the risk of that, not totally prevent it.
Infectious disease doctor Daniel Gregson says Sotrovimab is the first monoclonal antibody treatment being used for outpatients in provinces like Saskatchewan, Ontario, and now Alberta. But other versions of monoclonals have already been widely used in Canadian hospitals.
Well, that's where we've been using the other ones, is in the hospital setting. But actually in the United States, they've been giving monoclonals on an outpatient setting for at least 6 to 8 months now. So this is the first one we're actually delivering as an outpatient model.
And it's people like transplant recipients, eligible in Alberta regardless of vaccine status if they catch COVID, who can really benefit.
Those patients don't respond to the vaccinations we're giving them, and these antibodies can be life-saving in that setting. The average person, the vaccine is probably more effective in preventing hospitalization and death. It lasts for a longer period of time.
But says as treatments for COVID-19 start rolling out, companies like Pfizer and Merck, among those trying to get a pill treatment approved, they all work best in the first few days after showing symptoms.
Within 5 days to have the best benefit. So that means you can't sit home with a runny nose and a sore throat and a cough, thinking, well, I'll just see how this goes. We need to get you and get you tested.
To keep as many people out of hospital as possible. In Edmonton, Carly Robinson, City News.